introduce you to Arne. Arne, as you know, is one of us. He's a member of our club. Arne is the executive director at the Wellness Center, and he's going to share with us about who they are and what they do over there, and they do some great things. So, Arne, you're on.
Thank you so much, everybody. It is a pleasure to be here. And, you know, it's funny, I think back a few years, my wife and I, we have 3 kids. June will be 17 years we've been married, and we had for years had received grief from my in-laws that they didn't get to see their their grandchildren very often. And we weren't living in Twin Falls, and I came here to this Rotary group to do a makeup. We were visiting, and actually sat with Jeff Harris and another gentleman, and conversations introduced me to someone, and ended up in a job offer. And this club is a big reason of why I'm here in Twin Falls with my family. So thank you. But I'm really excited to share with you what's going on at the Wellness Tree. Now, as I came in, I spoke with a gentleman and said, "Oh, I was involved 10 years ago," you know, and I know there's a number of people that have been involved with the Wellness Tree, or previously it was called the Mustard Tree Clinic. And so for you, some of this will be an update. For others, this might be brand new. And so feel free to ask questions as we go. If you have a question, there's likely that someone else in the crowd has the same one. So feel free to raise your hand to ask questions. I'm the executive director of the Wellness Tree. I'm going to start with this quote by Winston Churchill. He said 60 years ago, "Healthy citizens are the greatest asset any country can have." And that's also true for cities, towns, and communities. And the health of our community makes a big impact on our economy. There's numerous factors that go into that, but it's a very important issue that the Wellness Tree we're working to help one sector of our community that struggles the most with healthcare issues. This is a picture in front of the Wellness Tree. We had a ribbon cutting here last summer with the unveiling of our new sign, and also the announcement of the start of the process to build a dental clinic and add dental services to the Wellness Tree. And the Wellness Tree is a community clinic. We receive no government or state or federal funding. It's all locally funded, and all of our providers are volunteers. And it's definitely a community clinic. It wouldn't happen without the people right here in our community. We are located in the on the backside of what used to be the Magic Valley Hospital. You can see a little bit of there's a plus sign right there in this picture. The helicopters used to land right there and rush people in the door back over here into the emergency room. So we occupy what used to be the emergency room in the old hospital. Easy to find. We're a standalone 501c3 nonprofit organization. We provide medical and a variety of wellness services that are all free for our patients. And this last year we had approximately 2,500 patient encounters or appointments, different types of appointments in the year. We're also a resource for our patients. We don't provide every service, but we help our patients get connected to many of the programs that are out there that can help them. And a lot of the drug manufacturers have programs for low-income individuals to get their drugs for free. But it's a complicated procedure to go through some of the paperwork and all of that. So we help guide many of our patients to find the resources that they need. And we're also a resource for the community. And what a lot of people don't understand is when a low-income, uninsured person shows up at the emergency room and they can't pay for their care, by law, the hospital is required to treat them and take care of them. But then we as a community pay those bills. And so the hospital, the county, there's numerous groups that have been very supportive and wonderful to work with. But when you understand that if we can help, if we can see a patient and get them on antibiotics or something simple, maybe it costs us $50 or $100 to see the patient, or maybe less. And we save that person from walking into the emergency room. We save our community a lot of money. on average across the country, I don't know what it is here locally, but I saw a statistic across the country. The cost to walk into an emergency room to talk to a physician costs $1,300. And so, and those bills are paid by us. And so if we can provide a place so that people that are low income, uninsured, can get the health care they need and get it early on, then often that patient can continue in their jobs, they can continue serving their families, and they don't have to wait until the problem is catastrophic for them, and they're in the emergency room, they're in the hospital for numerous days, and they can no longer serve their family and their jobs. And it's a much harder job to get a person back to a state of wellness after they've been struggling with a healthcare issue for a long time. So we have a local board of 9 volunteer directors. Actually, Jeff Harris is our latest addition, and we really appreciate all of our directors who give to the Wellness Tree. We only have 3 paid employees, myself, and we have a front desk secretary and then a nurse. And then we have over 35 volunteer providers that give their time every month. Often it changes from month to month, but on average it's around 35 volunteer providers per month. And then we have a caring community of businesses. There's a few foundations that give us grants, and individuals that contribute whatever they can to help us provide wellness and medical services to our community. There's a list of our board of directors, but you can ask for details later. Dr. David McCluskey, who's spoken here some years back about the clinic, he was one of the founders. Dr. Bob Lobb, who many of you know, he's our current chairman. And Dr. Lisa Burgett, she's our medical director of the clinic. We're open Monday through Thursdays during the day for daytime appointments. Excuse me, take a minute. And that's as long as we have a provider. Some days we don't have a volunteer provider, so we don't see patients on those days, but we're working doing other things, paperwork, and helping patients with other issues. Then we have walk-in clinics on Tuesdays and Thursdays in the evenings, and they start at 5:30 and run until we're done. So there's 2 different options for seeing a provider. If you want a specific provider, then the patient needs to call ahead and we'll set a schedule for when that provider is there. And then we have a lot of people that just show up for our walk-in clinics. And it's always it's a gamble. We don't know if there's going to be 30 people that show up or 10, or, we never know who's going to show up at the door. But who qualifies? This is an important detail here. We only accept uninsured or underinsured adults that are below 200% of the federal poverty level. And what that looks like is, for a one-person household, they can only make $1,945 per month. Going up to 2-person, it's $2,600. 3-person, $3,200, nearly $3,300, and upward. They can also be underinsured, which means they have a catastrophic health insurance plan. Say they have a $3,000 deductible that they have to pay out of pocket before their health insurance kicks in, and they don't have $3,000, they still can't get the medical care that they need. So we'll see those patients as well, until they meet their deductible, then they no longer qualify. I've had a couple of providers that don't know about the Wellness Tree say, well, don't you steal a lot of patients from other clinics and other providers in your community? And really, we don't, because our patients don't have money to see someone. They don't have insurance to go see a normal provider. And so we're helping these people get back on their feet so that hopefully they can get a good job, hopefully they can get insurance, and hopefully we won't see them in the future. So we're not looking to keep and retain these patients. We're helping them, as it are a number of organizations in our community, get these people back on their feet. Back in November, there's an article you might have seen in the Times News. It listed 23 organizations in Twin Falls that help with homelessness, which is one category, one part of our patient base. But there's only one free medical clinic for the low-income uninsured, and we work with all of these different organizations. And so I see the wellness tree as a crucial key, a crucial component of healthcare for our low-income community. So I just want to take you for a really quick tour. All of you might, I'd love it if you came and visited, but all of you probably will not be able to come and walk through or don't have time, but I'll take you for a really quick tour. The layout, you can see this is the old circle of the old ER, if you ever were in the ER. Patients come in, there's a waiting room, they get their paperwork done here, front desk, they get their vitals taken, and then there's a number of patient rooms around the circle. There's 4 different patient rooms here. There's a doctor or medical office, where the providers can chart their notes or look things up on the computer. We have a small surgery center here, which we started doing physical therapy in. This is a education or meeting room that is used by numerous different groups. There's looks like my battery died. I'll use a different one. See if this works. So this is a storage room, supply room. This is our eye exam room, counseling. And then these 2 rooms here I'm going to talk about more, but we're working to build a dental clinic in the wellness tree. And we're really excited about that. So the patient walks in, here's the front lobby, secretary, get their paperwork done. Here's the one of the main hallways. We've taken the ER rooms and turned them into standard medical patient rooms. Surgery room, we do small procedures. For a lot of procedures that our patients need that we don't supply, we will work with the county to get them those procedures. We don't do cancer treatment. We don't do large surgeries. But the county has an indigent fund that we can get them plugged in, and then they work with the county to get that care taken care of. So let's see if it still works. So we have a small counseling room here. This is the room we've been using for a dental exam room. The College of Southern Idaho Dental School, the dental hygienist school has used this to come in, and they come in with instructors and hygienists and examine patients. But we've never had the tools to actually do work, to do cleanings or pull a tooth, and that's what we're working to change. And in the past, this room has also functioned as a counseling room when we had 3 counselors at one time. There's our education meeting room. I'm looking to make a change here in the next little bit where there will be a flat screen TV here, and we want to add on education components that patients need that we can show them at the time that they come in for their appointment. Because what we found is a lot of the patients, they come for a medical appointment, but they don't either have the transportation or the time to come back for a class during the week. And so if we can have short education pieces that they can see right after their medical appointment, then we'll be able to add in a lot of the education pieces that the patients need but don't have the time to get anywhere else. And that's really true with low-income people. We find they just often don't have the education and knowledge to keep themselves healthy. The other thing is we have a lot of people from other countries. We have a refugee center here that we see a lot of these patients that don't have even basic education that our grade schoolers or high schoolers would have, coming from different countries. And so we deal with many different types of people. There's our waiting room. We also work with a number of different universities here in Idaho. There's a couple of those are physician assistant students, PA students. We have medical students, other students that come in and they will shadow the providers, and it gives them a place to learn, to get the experience, the hours they need to either graduate their programs, or sometimes they come in and get hours they need before they're qualified to enter a program. So we're helping our local students here complete their education, and we've seen a number of those students come back and serve here in our community after they've gone through the wellness league. We just added chiropractic services. Sam Barker has started volunteering and doing chiropractic and physical therapy services have just started up with Randy Clark serving as our physical therapist. This is one of the 2 rooms we're going to change into a dental operatory. It's actually coming very soon. This room we're supposed to get our first big shipment of equipment next week, but they got delayed a week or so. But we're hoping to have all the basic pieces up and running in March and possibly be able to start seeing dental patients in April. So we're really excited about this. In Idaho, as I did some research, I was shocked. In Idaho, the statistics show that 85% of adults have had cavities, and 30% of those adults have never had any treatment for those cavities. They're walking around in pain and dealing with the effects of those cavities. And your oral health impacts the rest of your body. And it causes many other problems throughout your body. And our low-income population have a very high percentage of dental problems that we hope to be able to help with. Suzanne Jameson, who's the president of the Idaho Hygienists Association, last year testified that Idaho is in an oral health care crisis. Almost half of Idaho adults have no dental insurance. And when large dental problems come up, it's very expensive to treat. And so we hope to be able to help with that. This is the layout of our dental clinic. And right here, as I was looking, how do I build this? I've never built a dental clinic before. It all fell together really well. In the hospital, there used to be a small shower room. This room here used to be a shower and supply room, and there's some cabinets in there. But in the corner here, there was an old shower that had been covered up. And so this room is now becoming our dental equipment room. I needed a drain for the dental suction, and the shower provided a drain. It provides some nice sound barrier for the air compressor and vacuum pump and things that go in this room. Then the air lines will go straight across here to this dental operatory, and from here they'll go through this wall, over this way, and into here for the second dental operatory. There again, there's that same slide, and here's where the 2 dental operatories will be, just on this side of the clinic. The Wellness Tree, we try to be pretty active in our community. We've done a number of different events that you might have seen, and if you see us at a fair or a health fair or something like that, please come say hi, and I'd love to meet you and talk to you there. Here's the Affordable Care Act is one issue that I hear about a lot. Is, well, with the Affordable Care Act, or some people call it Obamacare, why do we even need this health clinic? Well, if all the people sign up for affordable care plans that can, there'll still be 26 to 30 million people in our country without health insurance. A lot of people don't realize that. In our country, in our state, it's even higher than that. Our state did not, and we had a presentation on this a little while back, but our state has not increased our Medicaid spending to cover, they call it a coverage gap of people in our community, of low-income people. And so we have a higher percentage of people without health care insurance than half of the rest of the country. So there's 77,000 people that are in our coverage gap. And if we did expand the Medicaid spending to increase and cover the coverage gap, it would cover another 104,000 adults. I'm not going to spend a lot of time on this, but this shows the individuals that currently can get help through the Affordable Care Act. Individuals from 0% of the federal poverty level to 50% can get assistance with their health insurance. From 50% to 100% of federal poverty level, that's the coverage gap. Those people cannot get any assistance with their medical insurance costs. Then from 100% of federal poverty level up to 400%, those people can get subsidies for their health insurance. So it's sad these people here that make less than the people that can get subsidies these people need help more, and they don't get the help that they need. So I'm not here to say yes or no what we should do, but I'm just explaining exactly what this current situation is now. Minimum wage in our state is comes to just over $15,000 a year for a full-time worker. It's not a lot. The average annual cost of living in our state, it comes to about $24,000. So you can see people are hard pressed to pay their bills, let alone tack on medical insurance costs. In Idaho, kind of an unfortunate statistic, we have the largest percentage of minimum wage workers in the United States. And so I'm going to skip that. This is a kind of a guiding principle for us, the Wellness Tree. If many people give a little bit of time or help or finances, we can make a huge impact. And there's a number of people here that have given, and I so appreciate many of you and what you've given in the past. But I also invite you, if you're interested in helping out in any way, we'd love to talk with you. And I don't know whether it's time, assistance. We have volunteers that aren't medical professionals as well. So there's a number of different ways that you can give or give financially, and it helps us cover the cost of caring for these people. Currently, one of the physicians did a research project and estimated that at our current numbers that we save our community about $2.5 million a year by keeping the people that we keep out of our emergency room that can't pay those bills. And so I think the help that we give is greatest for those patients that get the help, but it also is a huge asset for our community. There's some of the people, a few of the pictures of people that have volunteered and helped out. There's many more that could be up there. We have an interesting dynamic, and I'm almost done, is in a normal business, and I have a business background, you would think that the more patients or the more customers you get, the more income you have. Well, for us, it's the reverse. The more patients we have, the higher costs we have. And so we have a number of different components we have to grow at the same time. We have to grow the number of providers to be able to provide services for more patients. We have to grow the advertising to bring more patients in. We have to grow donations to cover the cost of all that. And then we have to grow the advertising and get the word out about who we are, where we are, and what we do. And so with all of those, we have to grow those four things for us to be able to create a bigger impact for our community and grow them simultaneously. So if you can just, in hearing this presentation, if you know of someone that might be helped by the Wellness Tree, if you can share the name of the Wellness Tree and where we are to them, that would be of help to us and to them. And last, we just need people to know where we are, who we are, and what we offer, and who we serve. We don't want to make any medical or dental providers feel threatened that we're trying to steal their patients. We're here to see the patients that aren't seen elsewhere, and that's pretty much it. I have a sign-up sheet over here if you're interested in more information, or just come and talk with me. We'd love to partner with you and helping to provide services for our low-income uninsured residents. Thank you very much. Oh yeah. Hey, a couple. Any questions that you would have? Yeah. Some of the supplies and equipment we purchase, and some is donated. So we have a large volume of donations that show up at the clinic. Much of it we can't use, and so we either pass it on to somewhere else that can. Some stuff that comes in, it's contaminated, we have to throw it out, but we either buy it or it's donated. I had an interesting couple that came in right before Christmas, man and his wife, and he had his hand all wrapped up, and he explained he needed to see a physician. He had a problem with his hand. He unwrapped his hand, and he had a huge hook buried in the index finger, the base of his index finger. And he explained that 2.5 days before he had been fishing and got this hook stuck in his finger, He was afraid to go to the ER. He was afraid to go to the doctor because of the bills. He had no insurance, no money. And so it was a treble hook originally. And so he took it, got clippers, and he clipped the other 2 hooks off. He tried to get it out. He couldn't get it out. And he left it in there for over 2 days. It got swollen and infected, and he came in, and we were able to get the hook out of his finger. But I just can't imagine the pain that how did he sleep? How do you go function, you know? And a lot of people deal with things like this. They don't have a place to turn for medical services, and that's why we're there to try to help. So, any other questions? Or you done? Thank you.
Would you draw a couple of photos?